Have you ever found yourself washing your hands repeatedly, even when you know they're already clean? Or perhaps you feel uneasy after touching something as simple as a doorknob or a shopping cart, fearing that you might have picked up harmful germs? If so, you're not alone. These behaviors are often linked to contamination OCD, a subtype of obsessive-compulsive disorder, OCD, that revolves around an excessive fear of germs, dirt, and contamination. In this article, we'll explore what contamination OCD is, its symptoms, causes, and the impact it can have on daily life. We'll also dive into practical ways to cope and manage this condition. So, stay with us as we explore the ins and outs of this unique form of OCD. Contamination OCD is a mental health condition characterized by an overwhelming fear of germs, dirt, or any form of contamination. People with this type of OCD believe that their environment or their bodies are constantly at risk of being contaminated, which can trigger anxiety and lead to compulsive behaviors aimed at neutralizing or preventing contamination. The obsessions, intrusive thoughts, and compulsions, repetitive behaviors, in contamination OCD are not just about a concern for cleanliness. They are irrational fears that significantly impact the person's life. For example, someone might feel they need to wash their hands every few minutes to prevent infection, even if they haven't touched anything that would justify such behavior. It's important to note that contamination OCD doesn't just look like a simple desire for cleanliness. It involves distressing and disruptive symptoms that go far beyond what might be considered normal concerns about hygiene. Here are some of the common symptoms. 1. Excessive hand washing or cleaning. People with contamination OCD may wash their hands dozens of times a day, using excessive soap or sanitizers. They may feel compelled to clean every surface they touch, often repeatedly, to prevent germs from spreading. 2. Avoidance of certain places or objects. Individuals may avoid public places or even certain objects they perceive as contaminated. This can include steering clear of public transportation, public restrooms, or even shaking hands with others. 3. Repeated checking or avoidance. Some may repeatedly check if they've cleaned something thoroughly or avoid touching objects they perceive as dirty, such as door handles, elevator buttons, or bathroom taps. 4. Fear of infections or diseases. A constant fear of contracting illnesses or diseases, even when there is no evidence to support that fear, is common. This can lead to constant worrying about exposure to harmful germs. Living with contamination OCD can be exhausting and isolating. The compulsions to prevent contamination often take up a significant amount of time and energy, affecting both work and personal relationships. People with this type of OCD might feel like their lives are dictated by the need to clean or avoid certain situations. 1. Time-consuming rituals. The time spent on cleaning or performing rituals can interfere with daily tasks, including work or school. What might seem like a harmless act, such as washing hands, could take hours in the case of someone with OCD. This can significantly impact productivity and overall well-being. 2. Relationship strain. Obsessions with contamination can put a strain on relationships. Family members or friends may not understand why someone is constantly cleaning or avoiding certain places. Over time, this can lead to misunderstandings and feelings of isolation for the person with OCD. 3. Avoidance behaviors. The constant need to avoid situations or places deemed contaminated can limit social interactions and prevent individuals from participating in activities they once enjoyed. This can contribute to a sense of loneliness or depression. 4. Physical and emotional exhaustion. The compulsions themselves can be exhausting, both physically and emotionally. Repeatedly cleaning or avoiding potential contamination sources can leave individuals feeling drained, and the anxiety caused by these actions can lead to significant emotional fatigue. Why does someone develop contamination OCD in the first place? What causes these excessive fears of germs and contamination? There isn't a one-size-fits-all answer to this question, but several factors can contribute to the development of contamination OCD. 1. Genetic and biological factors. Research suggests that genetics can play a role in the development of OCD. If there's a family history of OCD or other anxiety-related disorders, there may be an increased likelihood of developing contamination OCD. However, genetics alone doesn't determine who will develop this condition. 2. Environmental factors and upbringing. Childhood experiences and environmental factors can also influence the development of OCD. For example, children who are raised in overly cautious or cleanliness-focused environments may be more likely to develop a fear of germs and contamination later in life. 3. Traumatic experiences. A traumatic event, such as a serious illness or a close encounter with disease, can trigger or exacerbate contamination OCD. The trauma creates a heightened sense of fear and anxiety, which becomes ingrained and reinforced through repetitive compulsions. 4. Cognitive factors. Individuals with OCD often have cognitive distortions, such as an exaggerated sense of responsibility or a tendency to catastrophize situations. These distorted thought patterns can make the fear of contamination feel more real and pressing, even when there is no actual danger. So, how do you manage and cope with contamination OCD? While it's important to remember that overcoming OCD takes time, effort, and sometimes professional help, there are steps you can take to regain control over your life. 1. Cognitive behavioral therapy, CBT. CBT is one of the most effective treatments for OCD, including contamination OCD. In CBT, you learn to recognize and change the irrational thoughts and behaviors that contribute to your obsessions and compulsions. One key aspect of CBT is exposure and response prevention, ERP, where you are gradually exposed to situations that trigger your OCD while resisting the urge to engage in compulsive behaviors. Over time, this helps reduce the anxiety associated with those triggers. 2. Medications. In some cases, medication may be recommended. Selective serotonin reuptake inhibitors, SSRIs, a type of antidepressant, have been shown to be effective in reducing OCD symptoms. Medication can help regulate the chemical imbalances in the brain that contribute to OCD symptoms. 3. Social support. Having a support system is crucial in managing OCD. Talking to friends, family, or joining a support group for individuals with OCD can help you feel understood and less isolated. Support from others can also provide the encouragement needed to stick with treatment. 4. Mindfulness and relaxation techniques. Practicing mindfulness and relaxation techniques can help reduce anxiety. Mindfulness encourages you to stay in the present moment and accept your thoughts without judgment, while relaxation exercises, such as deep breathing, can help you calm your nervous system. Living with contamination OCD can feel overwhelming, but it's important to remember that help is available. OCD, especially the contamination subtype, doesn't define who you are, and with the right treatment and support, it's possible to regain control over your life. Whether through therapy, medication, or self-help strategies, there are various ways to manage OCD and reduce its impact. Remember, you don't have to go through this alone, and seeking help is the first step toward healing. If you're struggling with symptoms of OCD, we encourage you to consult a mental health professional who can provide the proper guidance and support. It can be difficult to fully understand the emotional weight of contamination OCD unless you've experienced it firsthand. Many people with this condition are often misunderstood by others who may view their behavior as excessive or unnecessary. It's essential to recognize that these behaviors aren't just habits, they are driven by anxiety and distress. Case study: Sarah's story. Sarah, a 29-year-old teacher, had always been meticulous about cleanliness, but over the years, her concerns began to spiral into something much more serious. She found herself constantly washing her hands, checking the bathroom for any potential contamination, and avoiding public spaces where she feared germs might be present. Her routines became more rigid, and the fear of contamination overshadowed almost every aspect of her life. Sarah's breaking point came when she couldn't leave the house for a few days because she felt too anxious about stepping outside. The simple act of touching her doorknob or using her phone felt like a life-or-death matter. It wasn't just germs, it was the fear of something unseen harming her. Sarah's story is not unique. It reflects the distress many people with contamination OCD experience, where fear takes control of their day-to-day life, pushing them to engage in extreme and time-consuming rituals. Family and friends play a crucial role in the lives of those with OCD. However, it's important to approach support with empathy, understanding, and knowledge of how OCD works. Well-intentioned efforts to help may unintentionally reinforce the compulsions or dismiss the severity of the condition. Understanding the role of compulsions. It's vital for family members to understand that compulsions are not voluntary actions. For someone with contamination OCD, the compulsive behaviors are not simply habits, they're driven by deep, irrational fears. Attempting to talk someone out of their compulsions with logic, like telling them it's not dirty, just stop, often only increases the person's anxiety. Supportive strategies for loved ones. 1. Be patient. Recovery from OCD takes time. Acknowledge the person's struggles without dismissing their experiences. Encourage them to take small steps towards reducing compulsions and celebrate each victory, no matter how small. 2. Avoid enabling. Although it's difficult, try not to inadvertently support compulsive behavior. For example, if someone constantly asks for reassurance that they haven't been contaminated, it's important to gently avoid offering repeated reassurances, as this can reinforce the cycle of anxiety. 3. Encourage professional help. If your loved one has not sought professional treatment, encourage them to consider therapy. Gently suggest that a professional may be able to provide them with the tools to manage their symptoms. 4. Education. Learn more about OCD so that you can understand what your loved one is going through. Knowledge can help reduce frustration or misunderstanding and allow you to offer more effective support. One of the most effective therapeutic approaches for treating contamination OCD is cognitive behavioral therapy, CBT, with a particular emphasis on exposure and response prevention, ERP. Let's take a deeper dive into how CBT and ERP work and why they are so beneficial for individuals struggling with this condition. Understanding cognitive behavioral therapy, CBT. CBT is based on the principle that our thoughts, emotions, and behaviors are interconnected. It aims to help individuals identify and challenge the negative thought patterns that fuel anxiety and compulsions. In the case of contamination OCD, this could involve addressing the distorted beliefs about germs and contamination and replacing them with more rational, balanced thinking. How CBT helps with contamination OCD. 1. Identifying negative thought patterns. People with OCD often have distorted thought patterns, such as believing that touching something contaminated will immediately lead to illness or harm. CBT helps individuals recognize these irrational thoughts and understand that they are not grounded in reality. 2. Challenging and restructuring thoughts. In therapy, the therapist works with the individual to challenge the validity of these thoughts. For example, I touched something dirty, so I will get sick is replaced with a more realistic thought such as, I may have touched something dirty, but the chances of getting sick are extremely low. 3. Coping skills. CBT teaches individuals healthy coping skills to deal with anxiety without resorting to compulsive behaviors. These strategies are designed to help individuals face their fears gradually, building tolerance over time. Exposure and response prevention, ERP. A central component of CBT for OCD is exposure and response prevention, ERP. ERP involves exposing the individual to their feared objects or situations, in this case, situations involving contamination, while preventing the compulsive response, such as washing hands or cleaning. The goal is to reduce anxiety over time, helping the person realize that the feared outcome does not occur, even without performing the compulsion. How ERP works for contamination OCD. 1. Gradual exposure. In ERP, the therapist begins with less anxiety-provoking exposures, gradually increasing the difficulty as the person becomes more comfortable with the idea of contamination. For instance, an exposure might start with touching an object that is perceived as mildly dirty, such as a public chair, before advancing to more challenging situations like using a public restroom. 2. Response prevention. After each exposure, the individual is encouraged to resist performing the usual compulsive behavior, such as washing their hands or avoiding touching something again. Over time, this practice reduces the anxiety associated with the feared object or situation. While therapy plays a central role in treating contamination OCD, medications can also be an essential part of a comprehensive treatment plan. Medications, especially selective serotonin reuptake inhibitors, SSRIs, are commonly prescribed to help regulate the chemical imbalances in the brain that may contribute to OCD. How SSRIs help with OCD? SSRIs are a class of medications that increase the levels of serotonin in the brain. Serotonin is a neurotransmitter that plays a key role in mood regulation, anxiety, and impulse control. By increasing serotonin levels, SSRIs can help reduce the obsessive thoughts and compulsive behaviors that define OCD. Some commonly prescribed SSRIs for OCD include fluoxetine, Prozac, sertraline, Zoloft, fluvoxamine, Luvox. For many individuals, a combination of medication and therapy is the most effective approach. While therapy and medication are essential parts of treatment, there are also practical strategies that can help manage OCD on a daily basis. Here are a few tips. 1. Set time limits for cleaning. If you find yourself engaging in cleaning rituals, set a timer for a specific amount of time, say 5 minutes. Gradually decrease the amount of time you spend cleaning to reduce the compulsive behavior over time. 2. Practice mindfulness. Mindfulness involves paying attention to the present moment without judgment. When you feel the urge to clean or engage in a compulsion, take a few moments to breathe deeply and center yourself. This can help reduce the anxiety that fuels compulsions. 3. Create a support system. Building a network of supportive friends, family, or a therapist can be instrumental in managing OCD. Being able to talk to someone who understands your struggles can provide a sense of relief and motivation to continue working on your recovery. Contamination OCD is a challenging condition, and recovery often requires the guidance and support of a trained mental health professional. If you or someone you love is struggling with OCD, seeking professional help is the first step toward recovery. Why professional help is crucial. Personalized treatment. A therapist can tailor treatment to meet the unique needs of the individual, ensuring the best possible outcome. Guidance through exposure. ERP and other therapeutic techniques are best done under the supervision of a professional who can guide you through the process safely. Support for family members. Therapy is also an opportunity to provide guidance for family members who may be involved in the treatment process. Contamination OCD may feel like a never-ending cycle of anxiety and compulsive behaviors, but it's important to remember that recovery is possible. By understanding the nature of the disorder, seeking treatment, and utilizing coping strategies, individuals with contamination OCD can take steps toward a life with greater peace and freedom. The journey may be long and challenging, but every step taken toward recovery is a step toward a healthier, more fulfilling life. If you or someone you know is struggling with OCD, remember that help is available. With the right tools and support, it is possible to manage the symptoms and lead a life not defined by fear of germs or contamination. Disclaimer: this video is for informational purposes only and is not a substitute for professional medical advice. If you or someone you know is experiencing symptoms of OCD, we strongly encourage you to consult a healthcare provider for proper diagnosis and treatment.